Today we'll be focusing on autism spectrum disorder, known as ASD, and intervention strategies.
Aiden is a 5-year-old boy with autism spectrum disorder. Aiden lives with his mother Jenny and his mother's boyfriend, who recently moved in with them. Aiden's main support in his life comes from his mother and his grandmother, and as of recently, his mother's boyfriend. They live in a subsidized apartment building a few blocks away from Aiden's grandmother. Aiden loves Thomas the Train Engine and loves listening and singing to music. Aiden is echolalic, but is not otherwise overly verbal. He has a few 1 or 2 word phrases, which he expresses, such as drink please and walk, which he only recently began articulating. Aiden often gets frustrated and starts headbanging, throwing objects within his reach, pinching, hair pulling, or biting himself or others around him. These behaviors are shown to be especially prevalent at school. Aiden is currently trying to work on fine motor skills, as they are a struggle area for him. Aiden's strengths include self-regulation after an outburst occurs and only normally needs a simple reminder that he should de-escalate unless escalation has already occurred too far. Aiden currently shares an EA at school with one other child and has one-on-one support half of the time. When the EA is with the other child, leaving Aiden with his classmates and classroom teacher, he tends to escalate and struggles de-escalating in this situation, as it is a more chaotic environment without his one-on-one support. This has led to the title that he has behavioral issues. Having these behaviors has impacted the way others view and treat Aiden, and now he is starting to show signs of anxiety in his day-to-day life. Outside of school, Aiden works with a speech-language pathologist to expand his language as well as supplement existing language with a system called Proloco2Go. Aiden also attends occupational and physical therapy to work on motor skills.
During the early identification process, Aiden's behavior, which have been observed, must be presented in 2 settings, in this case, his home and school environment. The behaviors must have been seen occurring for a very long time. The behaviors Aiden presents have put a lot of stress on himself, his peers, teachers, his grandmother, and the mother's boyfriend. The situations that occurred that led Aiden to be referred for comprehensive evaluation were the temperament-related issues, repetitive behavior, communication, and language delays, reduced attention to social stimuli, a tendency to self-isolate, and abnormal body movements. The screening process Aiden was involved in is a brief assessment that involves using a standardized measure to identify whether a child like Aiden is at risk for delay or disorder. Aiden's screening process varies from other students and children because of the format, scope, and target population. There are 3 risk factors that play a role in Aiden's screening, and those are genetic, prenatal, and postnatal. Chys3p35 conducted a study that explored the diagnostic unity and discriminative ability of these tools using a clinical population of children referred to a special diagnostic clinic over a 3-year time span. The authors discovered that Autism Diagnostic Interview Revised, known as ADIR, and Autism Diagnostic Observation Schedule Generic, known as ADR, is led to approximately 75% agreement with teen diagnosis, with most consistency of being false positive diagnosed based on the measures. Lastly, the Gilliam Autism Rating Scale, known as GARS, was ineffective at discriminating between children that had various teen diagnoses and the scales that did underestimate the likelihood of autism.
One of the main challenges which Aiden and his family face are his lack of communication skills, such as speech and language development. This often leaves his family struggling, as they don't always know how to meet the needs of Aiden, as he is unable to communicate them. As well, it leaves Aiden feeling frustrated, as he does not always receive his needs and wants. After screening and diagnosis, it was clear that this was a main area of challenge for the family through screening and tests, such as the one Taylor mentioned earlier, like the ADOSG. And after this, Aiden was sent to an SLP. First, the SLP learned Aiden's case, such as his home life, his background, socioeconomic status, previous linguistic ability, and other components of Aiden's life from Aiden's teachers, professionals, and his family members. The SLP also conducted private interviews with Aiden and his main supporters, which are his mother and his grandmother. Then they also would assess Aiden for his cognitive, verbal, and motor abilities to assess functioning in these areas, as well as how they may interact or may be related. And from that, it was also found that Aiden struggles with his motor abilities, both fine and gross, and was then referred to an OT and a PT. Communication challenges can develop in those with autism for a variety of reasons, as addressed earlier. Some of the largest challenges come from Aiden's wants and needs that are unable to be met because of Aiden's lack of ability to communicate with others around him.
An individualized family service plan, IFSP, can better be understood as a legal document that focuses on the early intervention process for children with disabilities under the age of 3 and their families. While an individualized education plan, IEP, is a legal document that works to outline the necessary services and supports for children with disabilities that may affect their education from the ages of 3 to 22 years old. While IFSPs are created in collaboration with therapists or researchers, IEPs are typically created with the assistance of parents, teachers, and therapists. When developing an individualized education plan for Aiden, it is important to understand the environment around him, as well as his skills and weaknesses in regards to his learning. Since it is recognized that Aiden is currently trying to work on his fine motor skills, it would be beneficial for him to have activities or privatized lessons with his EA. These lessons or activities could include building with Lego, which would also help his organization if they were to be done in color coordination. It would be also quite useful to have a sensory box prepared for him, so that way when he feels frustrated or the urge to have a negative reaction, then he goes through his box and uses the items that would help him to ground him to the situation.
The best evidence-based intervention plan that we feel will facilitate Aiden and his family's abilities to meet their goals is a behavioral intervention plan known as a BIP. A BIP is a written plan that teaches and rewards good behavior for children. The purpose of this plan would be to prevent or even stop Aiden's misbehavior rather than punishing him for it. Some misbehaviors Aiden presents is when he gets frustrated, he headbangs, throws objects, and pinches and bites himself and others. Before a BIP is put in place, the school must understand why Aiden is behaving the way he is. This plan can also be implemented in the IEP. It is important that the BIP changes over time, especially if Aiden's teachers and families are seeing behavioral changes, whether they're positive or negative.
Pivotal response training, or PRT, is a type of training that could be used in a behavioral intervention plan, since it is a validated behavioral treatment that centers its focus on children with ASD. PRT is a more naturalistic intervention method that works to increase a child's motivation to learn, to monitor their own emotions or behaviors, and initiate communication with others. This form of intervention is widely used since it helps children to become more comfortable with themselves and in turn better their education or even their peer connection journey. When a child has the opportunity to learn and develop skills such as language play and social skills, it betters their chances of having a more successful development. PRT works to generalize skills across many settings with different people, which is beneficial since it is not only directed to one culture, socioeconomic group, religion, or other factors.
Another article that was conducted by Hansfield explains the amount of individuals who suffered from ASD. This is currently increasing within today's society and needs to incorporate intervention-based strategies. One of the strategies was incorporating parent training in order to help a child's cognitive behavior. This research was conducted on a 9-week program on the children who have suffered from anxiety, oppositional conduct, attention deficit, and hyperactivity problems. All these treatments incorporated parental help and guidance. This was done on elementary school children suffering with high functioning autism. In order to start these treatments, The researchers had to observe, collect the data, and see if the methods were beneficial towards the child. The results explain that incorporating parental guidance not only helped the children become more comfortable, but also helped the children overcome overall routines during the day, as well as their emotional and cognitive behavior.
Another article we found, McGilvery and Everest study focused on CBT behavioral therapy that was delivered in groups on the reduction of symptoms of depression, anxiety, and stress in young children with ASD. After conducting a quasi-experiment design, they used the design to compare individuals allocated to a group intervention program and other individuals that were on a wait list. The study discovered that the group who participated in the therapy had lower depression and stress scores on the depression, anxiety, stress scales compared to the individuals on the wait list. The study, looking at anxiety, there was no change in the children's anxiety level who were in the intervention group. Lastly, the article discovered that there seemed to be benefits from the intervention group 3 to 9 months after a follow-up. The study's findings demonstrated the potential CBT in a small group setting, assisting young children and youth with ASD who have symptoms of depression and stress.
In the next article that we looked at, which was written by Sonia Stace, behavioral and creative psychotherapeutic interventions with a 6-year-old boy diagnosed with autism spectrum disorder and comorbid pediatric TTM, it addresses a young boy much like Aiden. This boy has been diagnosed with TTM, or excessive hair pulling, as well as ASD. Aiden, however, has not been diagnosed with TTM, but he does show signs of hair pulling, as well as other sensory-related behaviors such as headbanging, pinching, and biting. Using behavioral interventions such as positive reinforcements, verbal praise, habit changing, and stimulus training, interventionists were able to help this child stop his TTM behaviors. This shows that the effects of this intervention can have on an individual with sensory-related behaviors and how it may also help someone like Aiden.
Aiden's family's priorities include him developing skills that will enrich his further development, such as being able to complete certain tasks on his own, as well as making friends, treating behavioral outbursts and escalations. A behavioral intervention plan will hopefully help Aiden develop his better relationships at school, improve social development by improving his relationships with peers and family. Hopefully this will impact his other areas of development as well, such as cognitive and language.
Most professionals used a BIP, which are similar to individualized education plans. As addressed on the slides below, the first factor is educators, which is considered either a homeroom or special education teacher, psychologist, social worker, behavioral therapist, and occupational therapist.
It is important that professionals use in the plan our understanding of others' cultures, as some ideas that they bring forward may possibly go against their cultural beliefs and values. For examples, some cultures might be against pharmaceuticals, like medication, so non-pharmaceutical ideas would have to be presented in the plan. There could be certain activities in the plan that go against the family's beliefs, as well as maybe the location that is used. By location, I mean if they don't feel comfortable with having others in their home, then the school environment would have to take place in the plan. Lastly, there could be certain professionals that the families don't feel suit their culture, so they might have to be excluded from the team as well.
For Aiden's case, the intervention should take place in a natural setting for him, such as home or in school. However, since most of his behaviors occur at school, this would be the most natural setting for him. Natural environments are settings where infants and toddlers with or without special needs and their families participate in everyday routines and activities that are important to them and serve as important learning opportunities. The strategy that should be used for Aiden's certain behaviors is a behavioral model. Behavioral models focus on self-sufficiency and independence in a child's daily life. Due to Aiden getting frustrated very easily, the behaviors he presents appear very quickly, and he seems to have trouble de-escalating them in a timely manner. Since Aiden does not have the skills to de-escalate himself, a special education teacher must be with him at all times. Within the behavioral model, there is a transactional approach which examines the intersection between characteristics of the individual and their environment. This relates to Aiden's situation because the school environment seems to trigger his behaviors and results in him becoming distracted in his learning and sometimes causes him to inflict pain on himself or others.
Understanding that each child is unique in their own way and has different types of severities of autism is the first step of beginning evaluations. Some of the steps include early intervention. The child and the brain are still developing, which is the best time to in order to minimize the problems with their peer relationships and to learn more strategies in order to promote positive behavior. One of the most important steps is getting help and the resources needed in order to enforce the child and to become the most beneficial and successful in life. Some of the steps include observing the child's behavior, getting the best basic information from their family lifestyle and routines, enforcing behavioral skills to promote positive behavior or negative behavior when it is appropriate. If those steps are not working, seek professional help, and they can come up with a plan with the family to make sure the child's best needs are at heart and the family feels comfortable.